Hello and welcome to the next installment of my double jaw advancement surgery video update to chronicle my recovery from double jaw advancement surgery to correct sleep apnea that occurred on March 29th, 2017. Hopefully you've seen the one that outlines the entirety of the surgery, and this is just an update of how I'm doing at a point in time from when I recorded the video that shows the impact of this surgery that has had on my life, on my day-to-day. So hope you enjoy. Thank you. So today is July 17th. My surgery was March 29th, so I'm 3 months and a couple of weeks out from the surgery. You can see that my face is slimmed quite a bit. Got the braces taken off, which made a big difference, I think. You can still hear the nasally sound. I'm actually on my way to the plastic surgeon right now. I went back to the doctor for my 3-week follow-up, and he said that it's going to require a new surgery on my nose to fix the septum that was deviated when they pulled the tube. And so I went to the ear, nose, and throat guy, who said, well, it's not such a quick and easy surgery because it's already been done once. It might be a bigger deal. So gave me a prescription to get the inflammation down even further, and we'll hope to see if that works. But I think I'm not as close to the surgery as I thought, at least from what I can tell, because inside the nose is really messed up. You can even see that, like on the outside, it's hard from here, but there's quite a bit of a slope in the middle of my nose. It's depressed a little bit in that the inside structure is gone, or at least distorted. I've got more cartilage that's pushing my nose kind of upward into like a little bit of a ski jump look, and it's obviously flattened and squared. So front on, it's okay. From the side, it's kind of jacked up. It's very frustrating, actually, when appearance changes so drastically. The swelling has gone way down, but I can still see some swelling in my face, primarily after I wake up in the morning, probably because of gravity or whatever. Swelling goes down throughout the day a little bit. I'm hoping to get that taken care of. I just got the screws right here that I can feel that are really right at my sinuses, and I believe that's contributing to the inflammation, because I got like this. Like, there's not a lot of room to smile and show my newfound teeth that from the braces, because my nose, it's all crunched up in here. It's all tight in this area. And, I've got to retrain muscles, I believe, for one, and for two, I need more room. And I think the nose, the septum being basically sideways inside my nose, as well as having the jaw push forward and affecting the cartilage, I think that's contributing to it. And in fact, I think it may even be causing, it's not so much as a lisp, but I do have an issue with my upper lip when I speak. It is kind of a lisp, and I think it's, again, because I have a hard time clearing my lips when I speak, and I think it's because of the nose. So hopefully the plastic surgeon will fix this, or give me some indication as to what we can do. I think trimming the cartilage a little bit will help on the outside, but on the inside, I think, is the big deal. And I need to keep working with the 3 doctors now: the jaw surgeon, the ear, nose, and throat guy on the inside, and then the plastic surgeon on the outside. So it's a much bigger deal than I was hoping for. As far as everything else goes, the nerves and everything are coming back. Very frustrating with my lower lip and jaw, in that I still feel like I'm on Novocaine. It's still tingly and itchy, and just obviously kind of different. So I'll try to give you another update as I get closer to, as I come out of the surgery and I get closer to figuring out what the final resolution is for the nose issue. And, thanks for hanging in there with me, and I'll give you an update soon. Take care. Well, I'd have to say that it was a pretty disappointing and frustrating meeting with the plastic surgeon. It turns out that the amount of buckling of my septum from the removal of the tube is pretty significant, and it's more than just like a little buckling because of because of pulling the tube. It's really because I've had a previous surgery to repair a broken nose and a deviated septum. So This will be the third surgery, so it's a little bit more difficult, and the amount of change in the appearance of my nose structurally is really because it's softened quite a bit and narrowed, and to get it back to be sturdy and to have a better airway, the recommendation is to use something pretty rigid in there, which would be either a part of my rib or a cadaverous rib to be placed inside the nose, which would then create like a not very pliable nose, a pretty stiff nose, which I don't know what that means, and then but it would give me a better airway for sure on the inside, and then appearance would be back close to normal. But it's a much more significant surgery, and so I was also referred to yet another plastic surgeon who deals more with like trauma, who could, who has more experience using, ribs to reinforce the nose. So I'm really pretty frustrated right now. I'm not expecting this to be like this. Again, not sure I would ever do this. I would recommend doing the double jaw advancement, albeit the airway is much better, my sleep is better. The drawbacks in the other areas of quality of life, from the nasal feeling of decongestion, the drastic change in appearance, that those things are different kinds of issues that are frustrating. So I guess I'm gonna go see what this guy has to say and keep weighing my options. But again, 3.5 months out, and we'll see what happens. This has been a longer deal here than I expected, even though I was told 6 months, 9 months to full recovery, or to the recovery that I'm going to have. Obviously, this surgery that will come up for my nose now is a reconstruction of my nose, which is kind of a big deal, and not real excited about it at all, because it's another setback. Either way, it is what it is, and I'll be updating you shortly. Thanks.